Hey guys, today I will be talking about pertussis, or also known as the whooping cough. Um, this is a disease caused by a bacterium called Bordetella pertussis. Pertussis usually affects the upper respiratory tract. It is an epidemic disease, and usually it is commonly found in children between ages 0 to 6 months old. And this is usually because at that age, they are still pretty young to have received a full course of vaccinations. I actually used to know a 5 weeks old baby named Mason who unfortunately died from the whooping cough. Um, they said that he died from brain damage and also multiple seizures. Um, so the seizures caused brain damage, and all that came with complications um, of pertussis. Disease characteristics: pertussis is a gram-negative bacteria. It is a strictly aerobic bacterium. It is a small shaped cocci bacteria. It is encapsulated. It does not produce spores. It does produce LPS toxins, and those are pretty bad for us. We all know that. Um, for virulence factor, so Bordetella pertussis bacteria would bind to our fimbriae, and fimbriae will usually allow the pertussis bacteria cell to recognize and bind to the cilia cells in the upper respiratory tract. And once it binds to the cilia cells, it then releases the LPS toxins, which then causes a lot of complications in the upper respiratory tract. Complications including the infection itself, and inflammation, and trouble breathing comes with your airways being inflamed or swollen. This is just a picture that shows the cilia and the fimbriae in the upper respiratory tract, and I think this little blackish guy in here that we can see, I think that's a bacteria just sitting in there, or pretty much trying to bind to the cilia and cause trouble. Um, Signs and symptoms. So we have early stage signs and symptoms including cold-like symptoms with a mild cough or a sign of fever. In babies, the symptoms and signs can differ. In babies, we see apnea, where babies will have will pause between breathing, and also cyanosis, where you'll see pinkish or purplish color around the baby's eyes or around areas of the face area. Um, you also see inflammation or swelling of the airways. In the late stages, there's rapid coughs, followed by a high-pitched whoop sound, which is why this is called a whooping cough. And also, you'll see vomiting and tiredness, and in babies, you'll see pneumonia and dehydration due to trouble breathing. Um, Pertussis can cause a cough that will last up to 100 days. This is just a photo that shows a baby with trouble breathing that's on oxygen, and also a baby with a little boy with cyanosis. Transmission: this disease is transmitted from a person to person, one person to another. Um, It is also transmitted to babies by active carriers or adults who has the disease and not even know it. Um, targeted population. Anybody can actually get purchases, but it mostly affects young children age 0 to 6 months old. For diagnosis, blood test, where the doctor will check for white blood cell count. Usually, a pretty high white blood cell count means a sign of infection, and this is just a general test. Um, Also, a chest X-ray where the doctor would check for the presence of inflammation. The treatment for this disease, antibiotics, just like any other bacterial disease. However, antibiotics for this for pertussis can be pretty pricey, so the doctor will look at certain different things before choosing the right antibiotic for you. They look at the cost, how old you are, how much you weigh, and certain things like that. Prognosis and prevention. Not everyone dies from pertussis. Adults can use over-the-counter medication to fight this disease. It's that simple for them. Babies are most likely to die from it, like I mentioned before. To prevent pertussis, vaccination is the best way to prevent it. And this is just a graph that shows how pertussis kind of progresses in each month of from the year 2008 to 2012. You can see that numbers increased significantly in June of 2012, and also you can see that also for every year near November and December, you can see that the numbers are kind of pretty high compared to January and February, March, and April. Um, the second graph kind of shows the same thing. You can see how it just starts from lower numbers to pretty significant increase in numbers. From looking at both the graphs and the numbers of cases, yes, I would say that this is a seasonal disease. So November and December, that is when we've seen a lot of increase in numbers of cases. So I would say, that is usually winter time on the US at least. And so yeah, I would say that this is definitely a seasonal disease. And this is my reference list. Thank you guys, and I hope you enjoyed this presentation. If you have any questions, just please let me know. Thank you.